Hi, good afternoon, everybody. Welcome to Policy Map Chats, Role of Geographic Data in Healthcare. We'll start the webinar in a few moments so we can let a few other people join. Thank you very much. Hi, everybody, welcome to Policy Maps Map Chats, Role of Geographic Data in Healthcare. We'll get started in about 1 more minute. All right, let's get started. Good afternoon, everybody, or I guess good morning to some. Welcome to Policy Maps Map Chats, Role of Geographic Data in Healthcare. I want to welcome everybody and thank you for attending. My name is Joel Nadelman, and I'm on the Policy Map team, and I'll be moderating this afternoon's panel. Before we get started, I wanted to just introduce Policy Map for those of you who may not be familiar. We are a geospatial mapping and data company. We allow our users to understand and analyze social, economic, health, and environmental conditions of communities and neighborhoods across the United States. We have over 170 publicly available and proprietary data sources. We have 17 years of experience under our belt, and we're founded initially by a nonprofit. We are a social mission-driven, woman-led, certified small business, and I'm really proud to be a member of the Policy Map team, and I'm really proud to bring you today's Map Chats. Just a brief introduction into the webinar. This will be a fireside chat style between me and my colleagues Ariann and Ken, a conversation with industry leaders. And we'll also be showing some supporting maps and other visuals that will help to facilitate the discussion. Just real brief housekeeping items. This event will last for about 1 hour. We'll have the speakers answering questions for about 45 or 50 minutes, and then we'll open it up to audience Q&A at the end. So feel free, please, to enter questions in the chat box, which should be on the side panel of the webinar application, and we will answer them at the end. If we don't get to them at the end, we'll do our best to answer them as a follow-up after the webinar is over. Also wanted people to know that the recording of the webinar will be shared, and we'll also have a post-webinar survey that we'd love for everybody to answer because it will help us to produce other map chats in the future with topics that are helpful and impactful to all of you. So with that said, let's get started. So I want to introduce my esteemed colleagues and panel members. I'll start with Ken Gross. Ken Gross is a data scientist and epidemiologist with over 20 years of experience advancing data-driven decision-making across healthcare organizations, including population health, health systems, and life sciences. He's recognized for integrating geographical information systems and spatial analytics into health research and strategy. Ken's leadership roles have included serving as maternal and child health epidemiologist for the city of Philadelphia, director of research at the Camden Coalition and Healthcare Providers, chief data scientist at the Chartist Group, and RWE group director at Johnson & Johnson. He currently serves as vice president of real-world evidence at Royalty Pharma. Ken holds a BA from Washington University, an MPH from Drexel, and a PhD in applied statistics from the University of Pennsylvania. And as I sometimes say, that's all Ken. Ken has a diverse background and career within different parts of the healthcare ecosystem, and at each stop of the way, he's touched various parts of spatial data. We'll hear that in many of the experiences he'll share today. So welcome, Ken, and thank you for being on this panel. Next, we have Ariann Nassel, is a senior GIS analyst and the director of Geospatial Data Visualization at the Lister Hill Center for Health Policy within the UAB School of Public Health. With over 20 years of experience, Ariann brings deep expertise in applying geospatial technologies to address public health challenges. She holds a BA in geography from Clark University and an MA in geography with a specialization in GIS and spatial analysis from the University of Georgia. Her work focuses on leveraging GIS to examine spatial patterns of health disparities, particularly among vulnerable populations, with an emphasis on HIV incidence testing and the social determinants of health. Ariann collaborates extensively with state health departments and academic partners to develop HIPAA-compliant geocoding methods, map public health data, and generate actionable insights for policymakers. Her strategic approach to geospatial data visualization strengthens healthcare systems by promoting health equity, guiding resource allocation, and enhancing community resilience. Welcome, Ariann, to the panel. Ariann and Ken are both good friends of PolicyMap, and we really appreciate your time today, and we appreciate you. So let's jump into the first question. The first question is for both of you, but I'll start with Ken. I'd like to invite each of you to reflect on a pivotal moment in your career, specifically when you first realized that spatial data was critical to uncovering insights and supporting the statistical, analytical, or medical aspects of your work in healthcare. Ken, let's start with you and then we can move to Ariann. Can you share one specific instance where spatial data had a meaningful impact on a project that you were working on? And from experience with broader lessons we can take away about the importance of geographic precision in advancing healthcare outcomes.
Yeah, sure. Thanks for the introduction. I'm excited to be here. My core moment with a GIS and seeing the power of it, it was in the late 90s and I was maternal child health epidemiologist. And our goal was to improve the health and well-being of women and children in Philadelphia. And our primary data source were birth and death certificate data, which the city collects. And we would work with that data often, and there was a big spatial component to. We were trying to deploy resources to improve the care of the population. So you want to deploy to the right places. So the birth certificate and death certificate data, we're looking at low birth weight and infant mortality. It had address and zip code, and traditionally people would aggregate data to zip code. What's the volume of low birth weight births by a zip code throughout the city? Because that's the only thing that was showing, the only data variable that was showing. Then I read an article in the Philadelphia Inquirer about how the police department was geocoding addresses to deploy resources, police officers, to address crime to the hot-spotting areas. I thought we should be doing that. Mm-hmm. So just purely out of curiosity, we started geocoding. We got the software, started geocoding the data, and what we realized is the ability to aggregate those points to other geographies besides smaller geographies besides zip code, and you could geocode them and aggregate. So geocoding is the task of taking addresses and putting them as points of a map, and it just looks like a complete mess of lots and lots of points across the map. But then you could use the software to count up how many of those points fall in, pick a geography. Zip code if you want, but I say don't use zip code, and I'll show you why. Right. Smaller geographies like block group or census tract. And when we did that, we found pockets that disappeared from the zip code level, but showed up at the block group or census tract level. So by using zip code, we were potentially shortchanging neighborhoods that had problems, but we were missing them. So what that showed me was the power of GIS. It was the first time I ever used it and was just awed by how many different questions we can answer. But the caution and different, I worked with data and statistics, and you have to be cautious with data and statistics, but you have to be cautious with spatial data in much different ways to make sure you don't make mistakes with it. And the whole goal, it's very powerful for data decision making, but you want to make sure you don't make bad decisions. And I believe we have a visual
Right.
that.
Yeah. So, I mean, it's a great example, and I think that the more granular you get, the more insight into the population that you'll have. And we have a policy map to show that brings this example to life. So why don't you talk to this a bit?
Yeah, this actually is more recent data, but it shows you on the left, if you look, this was some data that PolicyMap had regarding maternal vulnerability, but on the left, they aggregated that data to the zip code level, and that area in the circle is what I was talking about in my example. It doesn't look so dark as a dark purple. So you'd think those aren't the areas where we need to, and in that time, we had federal funding for Healthy Start program in North Philadelphia and West Philadelphia, and you can see why, the dark purple areas. And then when we geocoded the data, we totally missed that there was some issues in South Philadelphia. You look on the right, that's that same data at a different geography, and you could see when you aggregate it together that areas with good outcomes and bad outcomes cancel each other out and makes it look like. So there's actually a name for this in spatial analytics. It's the modifiable unit area problem. It's just basically the story can change based on how you aggregate the data, and it can cause you to miss things or make errors. So it was a very powerful first experience for me, and really got me hooked on the value and importance of spatial data in healthcare.
Right, absolutely. I mean, in South Philly, in this particular example, would be completely ignored. I mean, the actual vulnerability index in this particular example is much higher on the right for that census tract, sort of to the west of Rittenhouse Square. And on the left in the zip code, you would totally miss it. So really powerful example, and this is great, Ken, appreciate it. So moving on to Ariann, let's talk about that aha moment in your career. Can you share about that project that you first worked on where you saw the power of GIS in public health and how it drove real world interventions?
Sure. I do want to just sort of jump on the tail of what Ken was saying, which is so incredibly valuable and something that using the most granular level data, like the actual address data of patients or your population, is so beneficial, so that you can aggregate to different levels of geography. And that's something that I wish that we could just do an entire webinar on and sort of get everybody to understand the value in that, rather than using the zip code or the county or heaven forbid the 3-digit zip code.
We'll have more map chats in the future, so this is always good for more topics.
Great, I'm glad. So my gateway moment, I'd sort of dabbled in wanting to use GIS, or Geographic Information System software, in public health, but I really couldn't get a hold of anybody who was real interested back in like the 1990s and 2000. But I was real excited when I started working for Dr. Camilla Sasson at the Anschutz Medical Campus in Colorado in Denver. And she was real interested in a specific type of health outcome for out-of-hospital cardiac arrests. And what we did was to look at different neighborhoods within the city and county of Denver, and with the goal of identifying high-risk neighborhoods, and to work in neighborhoods. We actually use the census tract as a proxy for them. But the way that we defined high risk was by areas that had a high incidence of out-of-hospital cardiac arrest, as well as low bystander CPR. So these are all cardiac arrests happening outside of nursing homes and hospitals that anybody could step in and utilize bystander CPR. So using GIS and this EMS data from the CARES registry, which is a cardiac arrest registry for to enhance survival, what I did was geocode the location of each out-of-hospital cardiac arrest, and then ran 3 different types of spatial statistics to identify where hotspots were, and then overlaid that with the bystander CPR hotspots to identify areas where there was a high incidence of cardiac arrest, a low incidence of bystander CPR, and those we identified as high risk, and wherever they overlapped. In addition to that, which kind of brings it into a little bit of a real world usage away from what people would say like an academic or research world, is we map the distribution of AEDs throughout the city and county of Denver. And the reason for that is because once an AED is sold by a manufacturer, there's no state, there's no local policies to help identify where that AED goes. So we don't know where they are. And it's difficult for people to know where to get them to use them. That's an automated external defibrillator. And when you uses that with for a cardiac arrest, there's a much larger chance of survival. So using the information about the location of the AEDs and these high-risk neighborhoods, we were really able to use this, make evidence-based and data-driven decisions about where to tailor different targeted interventions in neighborhoods that really needed it. And we went in there and taught many classes of hands-only CPR, and it was really the most, some of the most exciting work that I've been able to do, and really had a nice, a really tangible outcome. And I love this multi-layer map that you have here of the city and county of Denver. And it's incredible because even without the individual data about where out-of-hospital cardiac arrests are occurring through a registry or EMS data, you can see here, you can track, this is the census tract, at the coronary, where there's a high percentage of coronary heart disease, a high percentage of obesity and smoking, and even, yes, where their social vulnerability index shows that there are vulnerabilities in that area. And this shows the confluence or the overlap of all 4 of those different metrics. And it's a pretty, it's not from the study that I worked on, but it actually does replicate some of the neighborhood areas. So that's a really great use of the data that Policy Map has available. Yeah, I appreciate you putting that up. So that's sort of my takeaway.
Yeah, I mean, it's really fascinating to learn about the hands-free CPR, and really that, a powerful example that to show that GIS was really seldom used, 20 years ago. It seems like it's a newer science, but it would have applied back to many years as well. So really appreciate that example. Okay, so I want to pivot from a moment from past back to the present and talk about your current role, Ken, in the pharmaceutical world. So pharmaceutical companies, they invest heavily in their field teams, in their sales reps, medical science liaisons, and they organize these groups by therapeutic areas. One of the persistent challenges that we've seen is designing effective catchment areas that align to both the provider distribution as well as the population needs. So in your work, you've used point-level provider data alongside of census tract information to tackle this issue. Can you talk a little bit about how the geographic data can support smarter catchment areas designed for field teams, and as well as some of the key considerations or even the pitfalls that you watch out for when using this approach?
Yeah, with any aspect of applying it to healthcare, you have to, geography to healthcare, you have to understand what's the spatial play. If you're not, and in pharmaceuticals, there's some other areas around the edges you might take a look at, market share, market penetration by geography. But really the spatial play is in the deployment of resources. Pharmaceutical companies send people out to doctors to tell them about the drugs and their, and share scientific information. And so a big effort is how to deploy those resources. And it's the unit of analysis is no longer really neighborhoods, it's doctors, and it's doctors nested within hospitals and health systems. More and more doctors are affiliated with hospitals than they've ever been before. So to understand not just where they're located, but the maybe the spatial network of who's connected to what hospitals. So you know, a big part of it is first understanding what your unit of analysis is. But the fascinating part of it is you're taking the entire United States, and how do we carve it up in a way that's the most efficient? Well, it depends on what therapeutic area you're working on, and it's really a matter of put all data on the table that's relevant. You might have data that's the epidemiology of a particular disease might distribute differently if that's who it's targeting. So you can take epidemiology data, you take the data on geographic location of where doctors practice and what hospitals they're affiliated with. I also encourage people to think, where am I going to get data from to inform this decision? But people are sitting on data as well that could be informative. Where MSLs are serving right now, most companies collect data on who they saw, when they saw them, what was the outcome. Taking that data and spatially enabling it, geocoding it, to combine it with where are doctors located, where have we been, where have we not been, and even census demographic data. But you have to understand what disease and what condition that you're looking to, and then put it all data on the table. And then the advanced methodologies come, like what is, with all these data sets, what is the most efficient way to carve this up where it's kind of an equal population. But to keep these data sets in-house and ready at all times, because you might people were revising their catchment areas all the time to keep up with different strategies. But I will say it is very hard to get really good data on where doctors practice, because doctors can practice at many different locations. So that geography, you think that's easy. That can be really hard, as well as who they're affiliated with. So just because you find a data set, validate the data set to make sure you're doing this analysis on a good data set that has the right locations for providers. But really, that is the key focus. And my advice is always find the right data sets for that particular disease, and then you can get into the more advanced methodologies on how to split it, and looking at that split in different ways. And there's some advanced software and some GIS software that allow you to take different variables and split it up based on different rules.
So just to elaborate on the pitfalls a little bit more. I mean, so people who might not use this spatial data as much as you do, I mean, what would you say, sort of what would their pushback be on some of the pitfalls of spatial data?
Some of the pitfalls, well, it's really the making sure you have accurate capture of all providers, and then providers and their affiliation.
Right.
But sometimes public data sets that are being sold with that, the company yourself, a pharmaceutical company, might have better information than the company selling it, because you have people in the field that actually called on them, and maybe they're not affiliated with that hospital. So that's why combining. But I think the pitfall is jumping into analysis. You find a data set, you do a lot of work to split it up, and like something doesn't look right, and it going all the way back to that first step. Of all the data you put on the table, was it quality data? You're going to have errors, but the signal should far outweigh the noise.
Right, absolutely. It sounds like, I mean,
you got to spend the time to validate those data sets that you're going to put into that model to help split the country in the right ways for your goals.
I've got a great example of that too. If we have time, do we have time?
Yeah, sure, go for it. Yeah.
So I was working on a project where we were looking at also catchment areas for different hospitals and of the patient population and where they were distributed around that hospital, so that we could identify vulnerable areas. And I received the data, I mapped it out using a choropleth map, and the statistician on it had been telling me, Ariann, the data is very strange. This is not like any other hospital we've worked with. I've never seen anything like it. I don't know what's going on. I've looked at it every single way that I can, and I mapped it, and within 2 minutes, I was like, what the heck is going on? There's no patient attending this hospital within a let's say 15-minute drive or 15-mile radius. So nobody near the hospital was utilizing the hospital. And the reason for that was because the data analyst assistant who sent us the data had not put a period after Saint, the abbreviation for Saint Vincent, County of Saint Vincent. So when they went to pull the county data, it didn't pull for St. Vincent, and it was missing an entire county of data that we could not figure out without actually seeing it. So there are many ways that looking at the geographic aspect can help. That one's rather pointed in a given direction, but you brought up like one of the most important things. You have to know your potential pitfalls, as well as how much benefit that doing this can bring you.
Right. Yeah, that's a great point. And so, Ariann, let's pivot over to you and talk about your current role at UAB. And so, Ken spoke about the iterative nature and the precise nature of analyzing this data to make sure that it's making sense for you. There's obviously a lot of different applications out there that can help with geospatial data. One of them, of course, is Google Maps, which is a fantastic app to use in your personal life when you need to find directions, but not necessarily the most complete for understanding the landscape of a specific area. So it would be great to understand how any projects that you've had, or maybe you sort of needed to encourage people to go a step deeper than, a Google Maps type application.
I have a really good one, actually. It was identifying and looking at food deserts in the metropolitan area of Atlanta. And when they came to us, they brought their data set that they had obtained using an app that scrapes Google search data. And they did that and using the search term grocery stores. So that had, they identified certain areas, and it just looked a little strange to us. And we looked at the grocery stores that they had mapped, and it was a high, very, very prominent were Publix's, which are here in the Southeast. And they're also semi-expensive. They're located in very specific areas. And did a little deep dive into the Google search results for one, and the reality is that it is not an exhaustive search, even though we think of Google as being so all-knowing and omnipotent. But so not every single grocery store was identified. Not every food distribution store was there. So the ones that are mainly presented are the ones that advertise and that optimize their online presence. Smaller independent stores like mom and pop shops, and whatnot are not necessarily there. Farmers markets, for example, are not necessarily included in that. And they left out, especially in some places that you might consider more vulnerable, those were left out. That ended up providing a very skewed understanding of the food landscape in that area. And so once again, it comes back to the spatial data, and you have to understand, where you're getting it from, what year it was, because that was a mismatch in the years as well. We know that things changed from before COVID to after COVID in the number of stores, but that's what I like about Policy Map as well, because you guys have a very inclusive overview, including farmers markets and supermarkets, the big box stores, all that kind of thing. So that's very helpful. Yeah, and this is a great map that looks at that food markets, grocery retail locations, that includes more than just a search on grocery stores and individual chain stores. And this is really neat because you have all this ancillary data. For example, the limited access designation, which is areas that have limited access to food resources, which are clearly available, clearly obvious in the purple, the bright purple designations here. So that's a really good map and impactful, because you see in the purple areas, you don't have many locations.
Right, absolutely. And just a quick shout out to our partners at the Reinvestment Fund who put together this really amazing and insightful limited supermarket access study for us to use in Policy Map. And yeah, this is a great example of showing the locations when where they're not.
This example reminds me of this quote that's often attributed to dashboard data visualization dashboards. It says a dashboard's not a good place to tell a story, but it's a great place to find a story worth telling.
Mm-hmm.
So these low access areas that you're finding, like it's very iterative. Like once you've narrowed it down to these purple, you're trying to find a story worth telling, that going deeper. And what's going on, and which ones can support a market, or what are the demographics of it. But just reminded me of that saying that, and that's true, I think, with maps in general, that if it doesn't, it's not a good place to tell a story because you're looking at a static image, but it's a good story to find it's a good place to find a story worth telling.
I like that. I'm gonna get that printed on a t-shirt, Ken.
I need it on a hat.
Right, hats, t-shirts, we'll do all the merch, coffee mugs, all that
tagline.
Yep.
New Policy Map tagline. It's a little long for a tagline though.
Right, a little bit, sure. We'll workshop it.
I've never walked away from a project with having a final story told in a sense. Like you get your outcomes and they're very beneficial, but there's never been a project where we haven't walked away with 10 more really impactful questions.
And that's the nature of research in general, and spatial should just be considered another tool in an analytics toolbox. So sometimes, which is best research in general is iterative by nature. Because sometimes you might put away the maps and then you start looking into something else about a particular area. But yeah, I always look at it as a tool in the toolbox of many for quantitative research.
That's great. Yeah, and so that's a good actual segue into the next question. This is again for you, Ariann, about using the geographical analysis to strengthen clinical research. And I think specifically, we spoke about it during your bio about looking at diverse and underserved populations. And so, how do you ensure representative participation and enrollment when you're doing clinical research? Can you speak about that from your experience?
Yeah, it takes a lot of work, but having a geographically diverse population for a clinical trial, study participants, it's really a key consideration for not only clinical research, but for many other types of health research. One example that I'm currently working on is the WHERE project out of Columbia, led by Dr. Rebecca Schnall, and out of UAB by Dr. Miriam Kempf. And what it does is it focuses on women who are at risk for contracting HIV, and it explores the use of mHealth, or mobile apps on mobile phones, to support prevention efforts, actually. And it really making sure that you have a geographically diverse population ensures really meaningful and inclusive findings. So the research team is actually purposefully enrolling from across the entire country, and then we map those locations and identify the region, for example, that they're in, so we can identify regional differences. And it's been critically important. For example, it's known that in the Southeast region, women have a higher rate of HIV incidence compared to other regions. And so by incorporating the different areas that these research participants are located and that are at high concern, then we can gain much richer insights and make them more robust and even impactful, because we're able to really identify, locations rather than grouping everybody into a single category. And then once again, you can tailor your interventions and know, is there a regional difference between people who are more likely to use an mHealth prevention effort than other areas. And in this map that's showing now, it's intriguing because you can see, and even at the county level here in Alabama, where it's known to have some slightly higher HIV incidence, that, you know, in Macon, the HIV diagnosis out of 100,000 people is 42.8, and then in Tuscaloosa, it's only 14.3. I mean, that is an enormous difference in the female population. And so that, you know, why is it like that? Like Ken was saying, you know, like we need to dig down and discover why there's such a difference in an area that's not that far apart. They're not really, you know, that dispersed even in space or in geography. So that's one of the reasons why I think that, you know, looking at clinical trial research participants from a spatial perspective and enrolling them from different areas is vitally important.
Right. No, that's great. And I think that this is a critical point, and it's something that I knew drew me to Policy Map. I mean, knowing that there's the data there that can help in these instances is really critical. And so, you know, it's one of the reasons why I wanted to save this example until the end. So this is great. All right. So we've got one question left, and then we can hop into some audience Q&A. So Ken, this one is for you. We know that geography shapes health outcomes around hospital growth, whether it's a neighborhood someone lives in or how far they are from the care. You've worked with data that combines this patient and neighborhood level insights. And I know that you've used tools like drive time analysis, geocoded claims to understand this sort of patient behavior and competition between hospitals. So again, you know, just how do you use spatial analysis to help uncover these health patterns, these market patterns, and most importantly, how can hospitals use these insights to design better community interventions and the best possible growth strategies?
Yeah, I think spatial has impacted hospitals in a huge way. It used to be hospitals like this is the place where people come to. You come to when you're sick, and that's it. And so the spatial component was that's where we are. We're just located where we are, and people live where they live, and there was no crossover. But you know, with population health and managed care contracts, they're often responsible for the health of patients even when they're not there. You want to reduce costs, so it's important to understand the environment where the patients are living, where they're located. So I think there's a couple spatial plays for, and then also the competition among hospitals is even strong, is very strong within markets. So even under the spatial component, where are my patients coming from? Where am I getting market share from? Where am I losing market share from? Those are all spatial questions, whether it's market share, whether it's understanding the healthcare needs of the population, or even with the Managed Care Act or the Affordable Care Act required hospitals to produce yearly community health needs assessments. All those hospitals, for all those questions, hospitals might ask, well, who do I buy data from, or where do I get data to answer all those questions? And I always say, you have the data there. So claims data gets sent out for payment. So every hospital, every visit that was done in a hospital or a doctor's office has a claim that's about to be sent out, and it's the claims database that's held internally. And on that data is the patient's name, their address, what insurance they have, the diagnosis code, the procedure code, the drug code if it was for a drug that was administered, the doctor who saw them. And I always tell people to activate that data, geocode it. And again, geocoding those addresses are just dots on a map. But to aggregate them to geographies, I think zip codes are too big. Smaller geographies using spatial software. And by doing that, you have a database that you can activate for all those things that I mentioned. For example, reducing healthcare costs, you know, you could turn on your map. Where are people coming from that were seen in the ER for asthma? Now, asthma is not the best place to be seen in the ER. If you find a spatial concentration of that, well, maybe you need you know, a satellite location there. Who knows what is? But again, you don't know the solutions. You can't start thinking about the solutions until you see the problem. So this kind of uncovers the problem. Also, you want to see where your footprint is for oncology, and or from a business standpoint, your oncology or your orthopedic, where are patients coming from and where are they not coming from? This is more from a business standpoint. You, in that claims data aggregated, you can turn that on. And one nice thing about aggregating to the census group, census tracker block group, that point level data, is you then have census data as well. So you're like, well, we have this many patients coming from this block group, and that block group's, the census has information on, well, that block group median household income is X. So combining the best of both, your data and the census data, putting it into a common language, which would be the same geography. Another area is even for reducing costs is care coordination, trying to provide care and home visits, remote care. Again, figuring out where patients are, high need. One example of use of claims data, when I worked in Camden, we convinced all 3 health systems that saw patients in Camden to provide their claims data to us as the honest broker, and we aggregated and geocoded it and looking at hotspots. So it was almost a population health database, and we could take a look at things from a population standpoint. But healthcare hospitals, the claims data the hospitals have can answer lots of questions, even that community health needs assessment. Often people say, well, where do I get the data? Do I need to do focus groups? Yeah, potentially do focus groups, but again, that data, if analyzed right, will show you what your patients are dealing with and where they're living while dealing with it. Lots of different, for health hospitals and healthcare systems, lots of different spatial plays or spatial components to how they do business, but a very powerful data set is what they already have in-house. It's just a matter of activating and analyzing in the right ways for the right questions, but can be used repeatedly.
Right, I think that's a critical point, and you know, applies to this, but many other things in life, is don't find a solution and go looking for a problem. Use the data, find what the problem is, and then you can cater the best possible solution. And so I think that's, you know, really insightful, Ken. Thank you. I mean, powerful example. I'm sure you can talk about this and the other things that we brought up today in much more detail, but I do want to move to audience Q&A. So just as a reminder, folks, we have about 15 minutes. If we can get to all the questions, that would be great. If not, we'll follow up with you afterwards. And just as a reminder, we're sharing the recording and a post-webinar survey. And please feel free to enter questions into the side panel. So the first question, I sort of laugh a little bit because it is true that we've gone 43 minutes and have not brought up the topic of AI, which might be actually a world record on any panel related to anything over probably the last 6 months or so. And so this is for either one of you, and it just, how do you personally use AI to aid or supplement your spatial analysis, or how can AI be used in a spatial way?
You know, that's a great question. I am only now starting to dabble with the use of AI to enhance my spatial analysis in GIS, using GIS. But ironically, just a few days ago, I actually asked ChatGPT 4.5 how it felt that the use of AI in healthcare research could be used. And it had quite a few examples, and many that I had not thought of. So while I haven't necessarily utilized it yet, other than, I mean, I use it almost on a daily basis for, you know, fine tuning, wordsmithing, brainstorming and things like that. But in the actual research area itself, there's a world of opportunity that's still being researched and made available to us. So that's my so far my interactions with AI.
It's great.
In my thoughts on AI, and I haven't ventured down this, used AI for other methodological questions, but I think once you move, there's the descriptive parts of spatial, showing a map of where things are. There's the prescriptive and predictive, and as you move down that, you start getting into more advanced methodologies, and there are methodologies that are quite different than your typical your typical data science methodologies. They're very specific to spatial. Like, how do you control for autocorrelation between the fact that different geographies are right next to each other? They have something very shared. They're not independent. It violates a rule of statistics. So there's a lot of complexity there, but the ability to, once you're ready to move on to more advanced, and it can be very tricky to figure that out, the ability to use ChatGPT and use AI to help understand the concepts and figure out the right coding. For those who move on to the advanced and are using SQL or R to take your spatial and look at do something predictive or do something forecasting based on spatial, I think it can really help reduce the learning curve for these concepts. Even someone who works in data science all the time, if you never worked in spatial data, a steep learning curve. But I think it can help with telling you what problem you're trying to solve for, and what's the right coding, what's the right package within R or SQL to address it. I think that's where it could be, reducing that learning curve for those who are ready to move into spatial statistics with their spatial data.
Right. Yeah. No, that's great. And listen, it's all around us. It's being taught to younger and younger people, and I think it'll just become more a part of what we're doing in every analysis, including spatial. So it's good to get some anecdotes about how you guys are using it. So here's the next question. This is for you, Ariann. Given the crisis in rural healthcare in Alabama, how can we use data to try and get information to our elected officials to address these issues around Medicaid cuts, insufficient reimbursement rates that don't cover costs, doctor shortages, service shortages that our local hospitals have been forced to close, and ortho services after losing birthing services? So, I mean, I think the overall question is around sort of the rural hospital and healthcare crisis.
No, it's a fantastic question, and there's a lot in that question to unpack. So I can't speak to all of it, but as a real-time evolving situation going on right now, I'd say we need data. We need to understand, for example, the shortage areas. I've worked on things mapping hospitals, which ones have had their obstetric units closed, which ones have their emergency rooms closed, which ones have closed. These things, it's sometimes actually hard to know where things are happening, but when you do, let's say there's been shared data from health departments and things like that, and when that is available, what we have used in the Lister Hill Center for Health Policy and found to be quite impactful is mapping out. We found that a map, much like a picture, is worth 1,000 words, and you can really understand what would be a full table of data within a minute or two of just observing that and sort of looking at a map. And so what we do is we map different situations, make infographics regarding the subject area that we're interested in, and we also use story mapping, which is a platform through Esri's GIS software that allows you to create an interactive web application that anybody can see. One project that I worked on, we did that actually for tree planting. believe it or not, and how important that was for the built environment in Birmingham and to decrease heat island effect and things. They took that and took it out and showed it to legislators and also different health departments, and were able to raise a great deal of funding. It was quite impactful, the visuals and the spelling out the type of analysis that we did to gain funding. But to making it accessible to the audience of the legislators is really the important part. And we found that a really good map goes a long way to doing that in a short amount of time. Let's face it, we are all restricted by the time that we have, and legislators, I don't envy them in this climate. They have very little time and everything is incredibly important. So you really have to make it accessible for them.
I just wanted to highlight one point. To do so, I think people to convey the impact can't forget the temporal variable. So to show what outcomes were, not just one map that shows what it looks like today, because there's no reference point, but what did it look like, the temporal variable, what did it look like 6 months ago? Or 5 years ago? Here's a map of what outcomes. Put it next to here's what it looks like today. So because we're focused on spatial, you think spatial, but you probably have temporal data as well, months, years. Putting to tell the temporal spatial story can be powerful to show the impact of whether it's a hospital closing or any other kind of policy or outcome.
No, I absolutely agree with that. It's just, unfortunately, there's very often a lag in obtaining data of the people that procure it, the people that are the people that collect it procure it, but and then it being disseminated. And so if everybody on this webinar can really promote that more health data be disseminated to the general population of researchers, academics, and the general population, actually, that that would make a huge difference in the amount that we could advocate for. I agree with you completely, Ken, that is very valuable, but there's just some things that aren't.
Yeah, I mean, that's so true. I mean, Center for Medicaid Services a number of years ago became much more transparent with the claims data and aggregating it, even to understanding the needs in states. And but you're right, that process takes a long time, and it runs. I think they just released 2023 data, and everyone really wants to know what's going on with their population right now, or at least to 2024. So you're thrilled when the transparency occurs. But often what happens, it's such a heavy lift for them to do and do it right that we're dealing with 2-year lags in the data that gets released. So that's definitely a problem.
Yeah, it is. And I forgot what I was going to add.
Well, really, I mean, super insightful. Thank you guys for both taking that one. So the next question is actually two questions that are both about drive time analysis. So I'm going to try to condense them as much as I can. But I guess that was a popular data item that you spoke about, Ken. So the question is specifically in the context of drive time analysis, can you speak to your experience adjusting for variables like time of day, traffic volumes, or other factors that may influence feasibility of patients or community engagement? And then the next question is similar. So not just traffic patterns and time of day, but also factoring straight line distance and accounting for other natural boundaries, mountains, rivers, et cetera, that may impact this.
Yeah, this is one of those things where methodology really matters. I mean, you can easily tell a spatial statistical program, calculate the distance between two things, and they call it straight line distance, or as the crow flies, it'll calculate that distance going through buildings, going through mountains. So you're not going to get a very accurate result of distance unless it's for some reason you're okay with that. But you really need to do drive time, and it's quite amazing how much the technology has changed. First, it needs to know, okay, what is the matrix of the roads, and it's amazing how over the last 20 years, just the road data is just terrific, including how big the road is and what the average speed is. And there is software that has those packages, which allows you to control for what time of day and put in other barriers. And you can run different scenarios basically and kind of look at different aspects. And you could even run it for, you could put in, people are using it for finding the right location. If you wanted to put a new clinic in and you're thinking of 2 different distances and it looks like it's really accessible, looking at runtime distance with these software packages. But definitely using drive time with the road, and the software has gotten so much easier. It's very easy for people to run that kind of analysis.
Oh, that's
Yeah,
great.
I'll jump in there if I can, because I do this every week, at least, a drive time. It's amazing. Like the street network data set is, I think, like one of the most important parts. And I don't want to be an advertisement for Esri, but they've got probably the leading street network data set, and they update it 4 times a year. It's fascinating because I can use it for geocoding as well, and literally geocode an address that can't be found in Google yet because it's so new, or it's a housing unit, for example, that's just been built. And so time, and then the roads that are no longer in use and things like this, because we are changing at an unbelievable rate throughout the United States. So I find, the Euclidean distance, or as the crow flies, to be really not necessarily very useful when we have the ability to do drive distance, drive time. They've got, you can, if you're driving in a truck, it's a different speed necessarily. And so you can do a drive distance for a drive time for a truck. It's fascinating. And rural drive times are different than more urban drive times. So it's absolutely fascinating.
For anyone who lives in New York City, you know that it takes you about 20 minutes to drive 1 single block. So it's a very different drive time than other communities, for sure. All right, so look, we have time for 2 more minutes. We have time for one more question. I want to sort of end on a light note. Are there any, this is for both of you, are there any courses or resources you would recommend for someone who is just starting off in GIS?
Ben, you want to go first?
Sure.
You can go.
Okay, I've got a ton of them. MOOCs, so massive online open courses, which are predominantly free. I would look for those. There's platforms like Coursera and Udemy, I'm not sure how to pronounce that have a lot of GIS courses that you can take on your own time and that are very accessible. Then there's the company Esri that has an incredibly massive amount of tutorials that are available on YouTube, and you don't need to have any type of purchased software or anything to work with them. They even have some of their own MOOCs, which are fantastic, and they give you free software for, let's say, like 6 months or the duration of that massive online course. And it's just been amazing. We don't have that many GIS courses at UAB, but we're definitely growing in that area. But I've had courses, MOOCs that I've given to students and said, you should try this out, not thinking that they probably would. And they learned things that I didn't know yet. They did the whole thing and along with their regular coursework, and just learned incredible things from just on their own time, no grades, no anything. You can learn a spectacular amount. And YouTube, Google anything on YouTube. And then AI has been fantastic. It's saved me lots of time. I just put in what I'm trying to do instead of going through all the directions and instructions. It gave me like a 4-paragraph, do this, 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 and this. And I was like, I can't believe it did that. And it worked.
That's great. Thank you,
So
Eric.
that's what my suggestions.
Thank you. Ken, anything and brief to add?
I wouldn't say I know any particular courses, but a strategy is, use any of those tools to understand the basics. And then whatever it is that you're interested in, jump in and find a data set because that iterative, you're going to learn more and more. And learn the basics, how to get your way around it, and then jump into something that is what a topic area that you work in, get a data set, pull some census data or something, because that's going to motivate you to do that iterative. By going iterative is you're going to learn so many different aspects of it. It'll give you the questions to keep going because you know that content, that you're interested in that content area. So learn the basics, but then jump in and keep learning around a topic that you're passionate about, because that'll push you ahead a lot faster.
Absolutely. And
Yeah, I totally
passionate, you
agree.
guys are clearly passionate about this topic, and I'd love to keep on talking about it, but we are out of time. Thank you so much to the speakers. It's been great working with you guys over the last few weeks on this. We really appreciate it. And thank you to the audience for joining. We're going to send the recording. Really would appreciate the post survey if you can fill it out. And we'll host another map chats over the course of the next few months. So thank you, everybody, and have a great rest of your day.
Thank you,
Thanks,
Joel.
Joel.
Thank you,
Thanks.
and thanks to PolicyMap for organizing this. This is great.
Oh, you're very welcome.
Absolutely. Thanks for attending, anyone.
Yes.